Hello everyone, welcome to Community Medicine Insight. In this video, we'll understand a very important concept in the public health, the difference between control, elimination, and the eradication of disease. Control means reducing the number of cases of a disease to a low level so that it ceases to be a public health problem. It means that that particular disease is no longer poses a threat to the community and it is no longer a burden on the health system. But the cases of the disease may occur. Goal is to reduce the burden of the disease, and burden of the disease is being measured by the illness and death that is caused by that disease. For example, when we control malaria through the mosquito control, early diagnosis, and the treatment, the cases may still occur. In control, we have decreased the burden of disease by continuous efforts of vaccination, surveillance, vector control. If we stop them, the disease will again come back. Next is the elimination. Elimination means the complete interruption of transmission of a disease in a defined geographical area. It means we are stopping only the local transmission of disease, but the disease can still occur in other parts of the world. And in elimination, the goal is to have the zero new cases in a defined geographical area. For example, the polio has been eliminated in India since the year 2014. There is no local transmission. But since the polio still exists in other countries, there is a risk of reintroduction of that disease. The elimination term is used for the regional or the national level, and it also requires the ongoing vigilance. There are two terms used. One is the verification, another is the validation. So verification is the process of documenting elimination of transmission of any disease. And declaring the elimination of any disease as a public health problem is known as a validation. Coming to eradication, the definition says that it is the termination of all transmission of infection by the extermination of the infectious agent through surveillance and the containment. It means in eradication, there is a permanent removal. It is a key term of any disease causing agent from the entire world. And in eradication, there will be no cases seen anywhere and there is a no need for further control measures. For example, smallpox has been eradicated in the year 1980 and polio is the disease which is being targeted for the global eradication. Once we say that the disease is eradicated, it means the disease has gone forever from the entire world. So this is a summary of control, elimination and the eradication. Control is a reduction of disease so that it ceases to be a public health problem. In elimination, we have reduced the incidence of the disease to zero in a particular defined geographical area. While eradication says permanent reduction to zero of the worldwide incidence of infection caused by any specific agent. So control is a term used for only local or regional level. Elimination is used for country or specific region. In control and elimination, continuous measures are required in both as the disease may reoccur. But once the disease is being declared eradicated, no further control measures are needed. In control and elimination, the agent is still present in the environment, but in eradication, the agent is no longer exist in the nature. So when we say that the disease is eliminated, it is first verified nationally by the government of India and then it is validated by the WHO. For the global eradication of the disease, it is done by the WHO after all the countries achieve the elimination. Slide shows various diseases their year of elimination and the certification. The list includes guinea worm disease, yaws, leprosy, polio, maternal and the neonatal tetanus, and the latest disease which is being eliminated from the India as a public health problem is trachoma, which was being certified in the year 2024. The diseases which are being targeted for the elimination in India are Kala Azar, filariasis, malaria, measles and rubella, and tuberculosis.